So, good day, colleagues. Today, our webinar is about E.H.R, which is one of powerful tool that helps providers to accomplish patient care at its best. Activities performed by a provider using patient information management, medical assessments, and diagnostic tests. Our speakers are Meetu Sharma, who has more than 14 years of vast experience in the healthcare IT, leading contributed as business analyst, product owner, and expert. And Alok Kushwaha, who has over 10 years of experience working as business analyst, product owner, business process expert for building B2B software products for healthcare and life sciences. So, colleagues, giving you a word.
Thank you, Lasky. Hello, can you share your screen? Because I cannot share my screen. It is disabled for me. Hello.
Yes, sharing.
Okay, thank you.
Yes.
Hi, everybody. So today we are going to discuss about EMR and EHR. And today we have just put around few concepts that we will understand so that tomorrow when we go into the advanced course, how all of these play together. For that, today we will learn all the basic terminologies. Can you go to next slide, please? Yeah. So for that, we will be covering, of course, the definition and some core features that can be expanded and discussed and compared and with each other, so that we will understand more about how EHR helps to improve health care for patients in next sessions. But here we would just understand what is an EHR solution providing, and how those things can help us to carry out day to day or a certain activity for patients. We will also cover some advantages, disadvantages, and how the market looks now. Can you go to the next slide, Alok? So yeah, um, definition, I would say that EMR and EHR probably do same thing. So they definitely take all patient history, medical history, their immunization details, and allergies and all such kind of things. So it is very simple. When you go to a hospital, um, more or less whatever happens, all the steps that happens, whether you step into a clinic or whether you go to a hospital or unfortunately into an ER. So there are different players and they use different modules, and that is what makes an EMR. So EMR is a record that when certain event happened with a patient, I covered all of the details, and this collection together becomes your complete medical history. Now, what is different between an EMR and EHR? So EMR was more on kind of department kind of thing. So it was more for providers, more for doctors. EHR, when it came into being, it it covered everything that EMR was covering, but it made sure that whatever I'm recording, I should be able to distribute it. I should be able to share it among other people, so that the healthcare can be decisions can be informed. That means I would have information about a patient if I'm taking next level of treatment for that patient, and when that patient is moved from one department to another, or many other scenario. I'm just picking one simple that everybody can connect to. Can you move to the next slide? So yeah. So today, when you see EHR or EMR, it is a very complicated thing, and there are so many modules, there are so many things happening, so many algorithms running, many things are happening. But basically, this came from a paper-based note that was developed like about 50 years ago. So it was based on actually four terminologies. It was subjective, objective, assessment, and plan. And till date, whatever thousand of things we are doing, it is still from this these four terminologies. So subjective is how the patient is feeling. How am I feeling? Or have from when on I have been feeling this, or any other such thing. So how is patient feeling? What is the patient's problem? Okay, then objective are we try to understand whatever a patient is talking. Based on that, are we able to understand the symptoms? Then we do tests, we do physical examination and everything to find out why this is actually happening. That was objective. And then based on whatever findings I sent for, those reports came in. I'm able to see, okay, the patient is having headache for 3 weeks. Okay, probably has sinus or something, or any problem that came up, so that I can treat them based on that. And plan, that means I would start planning. Now what all can I do? I can give them medication, I can send them for an x-ray or something. So the complete EMRs and EHR solutions are developed on these four terminologies actually. Alok, can you move to next slide? Thank you. So roughly I picked everything around a hospital almost that we would need to take care of a patient, or health providers, or doctors, as you understand, to carry out their day-to-day job easily. Also, make sure that whatever decision they're taking regarding a patient, it is a well-informed decision. So these are few modules. So it is demographic, scheduling, history, order results, medication, decision support, interoperability, security, privacy, patient management, electronic prescribing, clinical documentation, lab integration, and image integration. So we would be covering this throughout this session, and also after that we'll provide advantages and disadvantages. From here, Alok would pick up from next slide. Alok, please go on.
So if I ask you guys to recollect all the things, all the primary things which a caregiver asks you whenever you visit a modern hospital or a labs, those all things will come into a patient's demographic information. So some of them are patient names, patient age, gender, race, ethnicity, contact details, his income sources, maybe insurance details. So those all things are patient demographic things. They are used to maybe identify an individual patient, right? The next slide captures a small example of one of the tools which captures these information. So if you see there, the first tab is about who, which means about the patient core details, his name, state of birth, social security number, etc., etc. Then the next tab is about contact details, then the choices, employer details, guardians details for any minor or very elderly persons. In the second, in the below section, you can see that there are patient insurance details, his primary insurance details, his secondary insurance details, etc., etc. So these all things are patient demographic information. The next slide is the next thing which we want to do whenever we visit a caregiver is to schedule our appointment, right? So softwares capture that. Through this, you can schedule an appointment, you can reschedule an appointment, you can get notifications for your schedules. Provider can select their availability on the tool so that you can schedule accordingly, or you can get notification whenever the provider is out of his clinic or hospital. So those things are managed through scheduling of appointments. Now, in nowadays, the diseases are very complex, and to analyze a disease properly, you need to know the patient history, his family history, because there are a few diseases which are running through generations, right? Then there are a few personal history of that patient. Maybe he is going through some current medication details. So those things are captured in patient history section. The lifestyle talks about the patient current lifestyle, maybe his body mass index, maybe if he's doing any lifestyle activities like swimming or maybe jogging, because these things through this doctors try to think or suggest a better medication for you, because few things your body may automatically able to recover, right? In the next slide, May who will cover this.
Okay. So a very common thing that you come across when you go to a doctor, apart from getting some medication, is some kind of test, lab test, or some kind of X-rays. Depending on how you're feeling, um, how what is the issue you have gone with to the doctor or the physician or anybody. So let's say that if you have directly gone with probably you fell or something unfortunate happened, um, you would go and doctor would be sure because you are actually having a very high pain that they should go for an X-ray. So whether going for an X-ray or going for a blood test or any such intervention, when it is done, it is called placing an order for a patient. Now, these orders can be identified using, that means it is to diagnose what is wrong, that you cannot actually find out doing a physical examination. So they are codes called SNOMED, ICD, CPT. Okay, so these codes have alphanumeric values, or SNOMED has some alphanumeric value and some description connected to everything. So if I say headache, it would have a numeric value. See, in the screenshot I have put them, right? There is an identifying code, so that looking at this number, everybody can understand, okay, maybe they need a blood test. Just giving one hypothetical example. And so that everybody from the lab system, from the hospital, and also the insurance party. Insurance is a very big player. When you go to a hospital, the first thing they ask you is, do you have an insurance? So that's a big player actually. And the insurance party should also understand, okay, this patient has been asked to take this certain test, or this procedure is being done on, have been done on them. So placing an order helps you uh, to explain lab or a radiology officer that what needs to be done for the patient, what kind of test should be done. So I have also associated result here as the, can you move to next slide, Alok? So once a test has been asked to be done, some observation would come out of it. So in result, this is what we do. It is the act of observation. That means I am going to evaluate and understand as a physician that, okay, uh, let's say I said hemoglobin test. Is it meeting that if a person, a male client, sorry, male patient, are they having at least 14%? Female patient, are they having at least 11.5? Okay, so I would be able to see that number. I'm measuring it, and I would be confident if either I can say, okay, this is the reason, maybe they feel giddy, or I can write off, okay, because their blood hemoglobin levels are good. I can write off that it is not a reason. Same ways I can send specimen, or however it is required based on your severity, or based on how whatever problem or issue you have got. These things can be orders can be placed, and the results can be read, observed, and then a decision can be taken for the patient. Can you move to next slide, please, Alok? So medication management. So one very important part of um, any patient is, first thing is that after you visit a doctor is normally giving you a prescription where you say, okay, these many days, this is the dosage and all that. But there is more to this beyond just that one prescription that you receive. So there are reviews done. So prescribers have to review if they have given right quantity of medication, right units, right dosage, and everything has to be seen. Second thing is that you have to educate patient. that how they can take the medication, how they should not overdose it. So there are conditions where you cannot take extra medication. They have solid side effects. Then you have to also be very watchful about if you are giving a patient one medication and they're already taking some prescription medication, if they clash with each other. So you have to be very sure, because that can be really lethal and can have life-threatening effects. So all these are involved. And this medication management is not done by one party. There are multiple parties involved. They can be pharmacists, they can be nurse, they can be physician. Everybody can do this. Also, one major thing of medication management is inventory management. So I should also be having enough amount of medication, all the pills, all the things I need, so that I'm not running out of it. So that is also required in an hospital. Can you move to next slide? Yeah. So e-prescribing. So there are various way medications can be given. You can be given a handwritten prescription. It happens in few places. Otherwise, e-prescription is the best bet, because it is generated from an EMR or EHR. Not limited to EMR, EHR. Other products can also do this, but yes, EMR, EHR solutions nowadays definitely do this. And it has many advantages. First of all, the hero is for me is the reduce errors. So we are not giving them wrong medication and or wrong number of medication. Everything is electronically checked, so nothing can go wrong there. Also, it makes it very easy for you to refill if it is going electronically. And third thing is that controlled substances. So wherein certain kind of medication that has that can be addictive in future. So those things have to be controlled, and e-prescription module can really help you do that, because there are certain checks who can actually prescribe them. Then how many of them can given, a very tight check is kept. There's a full there are various methods these are done, can be covered in advance. Then reconciling the medication, that how many they have taken in past, how many they are taking now, and there should be a check how much medication I have given them. So all this is covered by e-prescription. So we have been capturing so much data around a patient. Not limited to this, but I'm picking an example. Let's say that I would pick USA, because and it's the easiest example. Somebody is staying in New York, and suddenly they shift to New Jersey. Now when they get sick, uh, their complete history is in a hospital in New York, and when they come to New Jersey, they do not have their medical history. So what can be done? All this complete history can be sent across to other hospital using certain documents, and these documents are called CCDA. That would be covered thoroughly in one separate session later on. So when I have to write a CCDA or a CCD, CDA is the architecture, that is the clinical documentation architecture that has been developed, that can be used so that all the parties, the hospital or the clinic I'm working from, the clinic where the patient has gone, or a clinic to hospital where you're referring, uh, every person can understand what I am writing where. It is an XML format, and that can be displayed in HTML as well. But I can totally understand what all patient has gone through in one file, in one document. And for that, the base is CDA. So hence I have shown this diagram here, where this is the template they will be using, and these sections would say, okay, orders, That means it will have entries. Okay, on this date, patient was asked to take hemoglobin test. On this date, they went for X-ray. On this date, they went for an MRI. So I can have such entries everywhere. This can be result. Okay, for this order, this was the result. So I can view everything about the patient. So the next party can easily understand what was done with the patient and take a treat them based on that. Can you move next, Alok? Yeah. So this is one very powerful tool, clinical decision support. So I have gathered lots of data. I have patient history. I have current illness. I have gathered 100 details about patient. I have all the raw orders, all the results and everything. Now everything is in your EHR solution. Okay. This product can come along with EHR, can come separately, but nowadays, it is present with an EHR solution, normally a full-fledged one. So it will gather all this data about that patient, okay? And there'll be some algorithms running in the background, and then they can tell that, okay, based on these symptoms, based on this history, all the test result and everything that I got from the previous hospital, patient may have this issue, and they should be treated like this. So they can give you a may or may not thing, and they can also give you, okay, because patient is having this thing, you can treat them like this, you can give this medication, this procedure can be performed based on the pain or based on the result you have written. So you can take a decision there, and based on that, the topics are printed and they can read and um, like they can decide if they have to take decision from that. Can you move to next slide, please?
And when we
Um,
capture so much personal information about patient medication, history of his information security becomes very important. And for US market, HIPAA is a very famous law which ensures the portability of information as well as accountability for the any misconduct or any breach of information. So as I said, its full form is Health Insurance Portability and Accountability Act. All EMR systems or EHR systems need to be complying this act, and they should make sure that there is absolute privacy of patient information. uh, HIPAA itself is a very big topic and may be covered later in some other presentation or some other day. But in general, it doesn't stop people from sharing the information. It suffice the portability of information, but make sure the companies who are working with the data are held accountable if there is any breach of information happens. That ensure the confidentiality and integrity and availability of the personal health indicators they can transmit, received, and maintain using the protocols as suggested by HIPAA, protect against reasonable anticipated threat or hazards to the security or integrity of the personal health information, protect against the use of disclosure of personal health information that are not required or permitted under the privacy standards or not authorized by the patient himself. In the HIPAA uh, allows the patient to make to say that this information I want to share with this, or this information I don't want to share with anyone. Anyone means their family members, right? So then ensure their workplace workflows will comply with the security policies and procedures, because it is accountability is keyword here. So HIPAA ensures that if there is any breach happens to any party, there are strict penalties financially, or maybe people can even go to jail if there are repeat breach of information. So
Thank you. So AI has become prevalent everywhere. So I also wanted to show one of the example where we can train a system to identify certain disease. So this can be done based on something called a generator, and it's actually a GAN system. And this has two systems. One is called generator and one is called discriminator. So let's say I'm a hospital, and I have to understand, or I have to train a system to identify cancer patient. I cannot have 1,000 patient who have cancer. 1 lakh people who have cancer. So how do I train my system still? Because if somebody is coming, this system should help me to some extent to understand if they have cancer or not. So generator is something wherein if I give them some real images, based on that, they generate different, what do you say, synthetic data, synthetic images. And what discriminator does is it has to understand if it is the fake data or it is the real data. And this is done in loop again and again so that our system becomes intelligent enough to understand if based on image, if a patient is having that certain ailment or not. So it will help us understand if a patient, like after a certain amount of training, that whether a patient can have this particular, let's say they have tumor or not, or they don't have a brain activity, they can do that based on image. So, so that, okay, because the system gets trained. And best thing about GAN is it removes noises. That means if I have an image and it is not clear, it will make it more clear and then generate. So it becomes more accurate and easier to estimate in future if the disease is there or not. Can you move to next slide? So kind of once data is gathered, the next step is definitely how to share it, because that's the whole game. In day to day, how will I be able to tell lab, okay, take a test? How can I tell pharmacy, okay, give them medication? How can I ask and radiologist to take an image? So all of this is done using certain protocols or standards. Um, in from EHR system, HL7 is something dominatingly used because it carries out your clinical data exchange using messages. I can say that, let's say how Alok started, that patient demographic was captured. That means a patient was registered. So when I walk into a hospital, they take my details and they register me to that hospital. So next step would be I would inform certain departments. If you're a inpatient, outpatient, I would just ask the billing department that they should start an account in your name. I would inform also the lab information system and pharmacy. But if you're an inpatient, then I have to send your information to various departments at a go so that they are ready for you. When I'm sending something, I ask for a bed change. They should be able to do it. Whether I want to see what all immunization you have taken, I should be able to do it. And there are many other parties. These are basically just some basic agencies that a EHR system would get added to. So I pick up three major these protocols. One is HL7, FHIR, and ICOM. HL7, as I discussed, these had divided. It actually allows you to send data in chunks, small chunks to other party, and request data in small chunks. And it's a whole standard. And we will also have one session on HL7 in future for sure. Then FHIR. FHIR is actually based on HL7 version 3, but it is more smarter. It works based on APIs and resource forms. So everything is placed in one places, and they are fixed formats. You can just create and send your own data, decide whom you want to share it with, and that's it. It is pretty smart, and it is slowly becoming prevalent. But right now, HL7 version 2 still captures 80% of the market, but slowly systems are moving to FHIR. DICOM is one standard that will help you save images. And once this image is available, other systems can pick from there. So radiologist can take an image and put it into DICOM. And from there, EMR or any other party who needs it should have privileges, should be able to see those images. Can you please move on to next one? Yep. So imaging integration. So EHR, EMR in itself cannot do this. So I would integrate it to a radiology software and a PAC system. PAC system would have all the all the images, and a radiologist would look into these images and then write down the reports in a radiology information system. And EHR can talk to both the software and um, get the required information so that the physician can understand how they have to treat their patient, whether they will have to refer them to a next level, or whether if the bone is not broken, probably it is just some small hurt and I can just give some medication and they would be good. But if they have a broken bone, I have to definitely refer it to next level. So this imaging integration helps me to take that decision as a physician.